And a safety alert for you. South Carolina health officials say 3 new measles cases have been reported in our state since Tuesday. So this brings the total number of cases now up to 156. 153 of those are related to that outbreak in the upstate that we've told you about for months. 252 people are in quarantine and 3 are in isolation. We are told the 3 new cases are from a previous reported school exposure. And as a reminder, measles is contagious for 8 days, 4 days before a rash shows up and 4 days afterwards. Doctors say you should always watch for a cough, fever, runny nose, and red eyes. If you believe you have measles, stay home and call your doctor.
If you flew through Denver International or Boston Logan earlier this month, health officials say you may be at risk of contracting the measles. On December 11th, authorities say an unidentified visitor flew from Dallas to Boston, traveling through other parts of Massachusetts before flying to Las Vegas the next night. That same evening, officials in Colorado say an out-of-state traveler with a confirmed case of measles traveled through Denver while infectious. The measles is highly contagious and can be deadly. It spreads by air even 2 hours after an infected person leaves the room, and symptoms can take 3 weeks to show up.
Those symptoms are fever and a rash, and generally one of the 3 C's. And the 3 C's are cough, conjunctivitis, which is pink eye, and coryza, which is a runny nose.
This year, the CDC reports more than 2,000 cases, including at least 3 deaths. Outbreaks from Arizona and Utah to South Carolina are also fueling the spread. Experts say the MMR vaccine is the best way to protect yourself. But NBC News' months-long project, The Vaccine Divide, shows that 77% of counties and jurisdictions in the U.S. have reported notable declines in childhood vaccination rates overall since 2019. Meanwhile, U.S. Health and Human Services Secretary RFK Jr. has publicly questioned vaccines and taken steps to change the childhood vaccination schedule. Jesse Kirsch, NBC News.
6 years ago, an alert from Wuhan quietly flashed across the world. Few grasped it then, but it would soon change how humanity fears invisible enemies. Now another silent threat is spreading slower, quieter, but stubbornly hard to kill.
Six years ago today, the world first heard of a mysterious virus emerging from Wuhan. Back then, it sounded distant, contained, almost abstract. Within weeks, it wasn't. COVID-19 rewired global health systems, exposed vulnerabilities, and taught one brutal lesson. Microbes evolve faster than human complacency. Now, scientists are tracking a different kind of adversary, not a virus, a fungus. Its name is Candida auris. It doesn't spread with explosive speed. It doesn't shut down cities, but it refuses to die. Candida auris is being described as a superbug fungus because it resists most known antifungal drugs. In some cases, all of them. Health officials say more than 7,000 people have been infected across 27 U.S. states, largely in hospitals and long-term care facilities. Globally, Candida auris has now been detected in over 50-60 countries across 6 continents, its burden rising year after year. The most common symptoms are skin and nail fungal infections. A patient may suffer from digestive issues like bloating, constipation, and diarrhea. They also feel tired and worn down along with fever and chills. Some female patients also develop vaginal infections. What worries scientists is its adaptability. Candida auris appears to be learning, mutating, outsmarting drugs. Faster than new treatments can be developed. Climate change, global travel, and crowded hospitals may all be helping it spread.
Okay, so we've got new flu numbers just in from the CDC this afternoon. We're getting them as millions are packing airports and getting ready to celebrate the new year.
Yeah, the latest data shows flu hospitalizations have actually doubled over the past week.
Sarah Allegre live in Riverside, California with more on what, Sarah, they're calling the super flu.
Yeah, Scott, Sylvia, I mean, we're seeing those cases rise. I'm seeing it personally in my own home. Everybody I know, or at least someone I know, and I know it's the same story for a lot of other folks across the country, are either experiencing it or know somebody who is. And we are seeing that this year in particular, this flu season, is acting a little bit differently when compared to past seasons. I mean, looking at the latest data from the CDC that we got just today, it shows that 19,000 people have landed in the hospital so far this week. That's the most recent week for the CDC's reporting. That's up from under 10,000 from the week before. And doctors say the reason lies within a new variant.
Just so happens that this subclade K variant that we're seeing really does seem to spread very efficiently. It's just part of its genetic makeup. It's just something that it does. But you know, this is definitely a reason to get your flu shot, and it's not necessarily more deadly, but it is spreading very, very efficiently. And with that, hospitalizations have really started to increase.
Yeah, and this map from the CDC, it shows the jump. Nearly 30 states with high to very high flu activity. It's really growing. Colorado, Louisiana, New York, New Jersey, South Carolina as well. It's shown here in red. That's the worst of the worst. And so far, over 7.5 million people have tested positive here. 81,000 have wound up in the hospital. But sadly, 3,100 people have died, including at least 8 children. Now, right now, the most common strain is influenza A, with the super flu variant dominating. That subclade K, rather, especially amongst children. The most common symptoms right now, guys, are fever, body aches, cough, that sore throat, that intense headache that you get as well. But doctors say some patients are also reporting that trouble breathing, chest pain, stomach issues, and unusual weakness, feeling very tired right now. Antiviral medications, that can help, and doctors say they work best when treated early. Now, here in the state of California, we have seen those cases rise as well, especially amongst children per state health officials. They do say, though, right now, hospitalizations are low, but expect that to change. Looking at the state of Illinois, it is lower in comparison to other states, but looking at the city of Chicago specifically, they are reporting that cases have grown from moderate to high, or low to moderate, rather, within the course of the past week. So definitely good to be on guard during this time of year, of course, as we have those gatherings very, very soon as we ring in the new year.
Now to news from across Texas. State lawmakers are looking into what could become a crisis here in Texas, the New World screwworm. It's the larval form of a fly that nests in the wounds of warm-blooded animals and slowly eats them alive. It hasn't been detected in Texas yet, but it's in Mexico. State leaders fear it could devastate the Texas cattle industry. Today, members of the Texas House held a hearing specifically focused on the screwworm. They heard from a number of state agency leaders as well as industry leaders who are working together to prevent the screwworm from coming here to the Lone Star State. They say it's a serious threat.
At the recent WAVP, the World Association for the Advancement of Veterinary Parasitology conference, we convened global leaders to discuss this outbreak. And the consensus is very clear. The question is not if, the question is when the fly is going to cross the border.
State leaders also said they are working with federal partners on things like deploying sterile flies and hopes of preventing the screwworm.
Seems like yesterday, or to some a lifetime ago, but 6 years ago, an alert from Wuhan in China quietly flashed across the world. Few grasped it then, but it would soon change how humanity fears invisible enemies. Now another silent threat is spreading slower, quieter, but stubbornly hard to kill. Take a look.
Six years ago today, the world first heard of a mysterious virus emerging from Wuhan. Back then, it sounded distant, contained, almost abstract. Within weeks, it wasn't. COVID-19 rewired global health systems, exposed vulnerabilities, and taught one brutal lesson. Microbes evolve faster than human complacency. Now, Scientists are tracking a different kind of adversary, not a virus, a fungus. Its name is Candida auris. It doesn't spread with explosive speed. It doesn't shut down cities, but it refuses to die. Candida auris is being described as a superbug fungus because it resists most known antifungal drugs. In some cases, all of them. Health officials say more than 7,000 people have been infected across 27 U.S. states, largely in hospitals and long-term care facilities. Globally, Candida auris has now been detected in over 60 countries across 6 continents, its burden rising year after year. The most common symptoms are skin and nail fungal infections. A patient may suffer from digestive issues like bloating, constipation, and diarrhea. They also feel tired and worn down along with fever and chills. Some female patients also develop vaginal infections. What worries scientists is its adaptability. Candida auris appears to be learning, mutating, outsmarting drugs. Faster than new treatments can be developed. Climate change, global travel, and crowded hospitals may all be helping it spread.